This is the third recording for the HIV/AIDS content, and it's going to go over interventions. So, the priority problems for the patient with HIV is the potential to transmit the HIV infection to others, as well as the potential for infection and life threatening complications due to reduced immunity. The first thing we're going to look at is preventing infections in the patient with HIV and AIDS. So we want to watch for early signs and symptoms. Recognize that patients with leukopenia, which remember is low white blood cell count, may not exhibit traditional signs and symptoms. Plan to intervene even if something as simple as a low-grade fever is detected. So because the patient's immune system is weak, their body's not going to leverage as much immune response to an infection. So they might not appear super sick and have a super high fever because the body's not working well to fight the infection. So they're not having those signs and symptoms. Your textbook has two nice boxes. One's related to prevention of infection, and the other is care of the patient with reduced immunity who is hospitalized. So I want you to look at those on your own. Caring for a patient with reduced immunity isn't a new concept for you. That's sort of a fundamental concept in nursing that you've covered already. But look it over because there might be some tidbits of information in those boxes that you hadn't been presented before. For example, the don't change cat litter. It might seem logical. Yeah, we don't want to change cat litter if our white blood cells aren't working right. But now you're associating with toxoplasmosis and HIV/AIDS, and so you're putting all those pieces of the puzzle together. So on your own, since most of that's going to be review, if not all of it, I want you to look at the two boxes related to prevention of infection, and the other one is care of the patient with reduced immunity who is hospitalized. Another way we're going to take care of this patient is through medications, drug therapy, and it's important to remember that medications for HIV do not kill the HIV virus. What they do is decrease viral replication. The patient with HIV will be taking more than one medication. They'll be taking multiple medications used together in a combination known as combination antiretroviral therapy, or CART. So combination antiretroviral therapy is known as CART, and that's saying your HIV patient, your AIDS patient is going to be taking multiple antiretroviral or anti-HIV medications in order to treat their infection. This approach, taking more than one antiretroviral medication, helps to reduce viral load, improve T cell counts, and slow the disease progression. It's important to teach your patient that they must be compliant with their medications, because if they're not taking the medication as prescribed, there's a risk of the virus becoming drug resistant. So it's imperative that our patients take their HIV medications as prescribed. Within the textbook, you have a big long list of medications that you will not be required to memorize for testing purposes. Just sort of general, there's different classification of HIV medications that interfere with certain steps of the HIV viral infection stages. So those are things that I said you don't have to memorize all these different stages. We just want to know that HIV hijacks the T cell. Well, these different classifications work at different points of the infection. You don't have to memorize them. It's worth noting, though, if you look at the ending of many of the medications, not all of them, but some of them, they end in VIR. So it's putting it together that suffix VIR stands for, in many medications, it stands for antiviral medication. Okay, so next up is gas exchange facilitation. Specifically, it talks about patients who have the P. Yervici pneumonia, or PCP or PJP, often has gas exchange issues. That makes sense, right? If you think about a pneumonia, that specific type is an opportunistic type of pneumonia. But if you think about pneumonia in general, we're worried about oxygenation. So what are we going to be looking at? This is review for you. Assessing respiratory rate, rhythm, depth, breath sounds, listening for those adventitious or abnormal breath sounds. We're going to be checking our vital signs frequently. Patient might need mechanical ventilation if they have a poor status. They may need suctioning. The textbook talks about pulmonary hygiene. What does that mean, pulmonary hygiene? Sometimes that term gets students. So I think of hygiene as keeping things clean, right? Pulmonary is the lungs. So how do we keep the lungs clean? We do deep breathing, coughing, and incentive spirometer, right? Those are all examples of pulmonary hygiene methods. Other things listed is evaluating ABGs and positioning of the patient, raising the head of the bed for comfort and for improved oxygenation. We want to encourage rest when needed if a patient is easily fatigued and pace activities. And then some other interventions we might have in a patient who has problems with gas exchange could be supplemental oxygen, bronchodilators such as albuterol, and glucocorticoids that are used to reduce inflammation. For pain management, many patients in stage 2 experience peripheral neuropathy from drug therapy or from the disease itself. They can have pain from enlarged organs, stretching the viscera, or compressing nerves, or a tumor invading bone or tissue. The patient can get pain medications for this, and the strength of the pain medication depends on the type of pain they have. They might get medication specifically for nerve pain. Might remember that from your diabetes chapters, right? There can be medication specifically for nerve-related pain for peripheral neuropathies. Nutrition enhancement. When we talked about some of the symptoms of a patient with AIDS, there was a handful of GI complications, right? So anorexia, nausea, difficulty swallowing, malabsorption, diarrhea, those were all listed there. So if the patient is suspected, if it's suspected that the nutrition is compromised due to drug therapy, the healthcare provider might need to change the drugs. If the patient has candidiasis orally, also known as thrush, we'll want to get an antifungal on board to treat that. They could have an esophagitis if that fungal infection is going down the esophagus. That makes it difficult to swallow and therefore decreases the amount that they're eating or drinking. They can get an antifungal prescribed if that's the case. If they have a thrush, any oral lesions, we want to make sure that they have a nice soft toothbrush, and we want to encourage them to remove any dentures if they're wearing them and make sure they're cleaned. And if they have any pain when the dentures are in place, that they leave the dentures out of their mouth. For nutrition, we can get a registered dietitian on board. They can make sure they have high protein, high calorie foods that are easy to swallow, get them supplements if necessary. We want to remind patients to avoid eating raw fish or meats and to make sure that they wash fruits and vegetables and properly refrigerate foods. And that's all getting at, we want to decrease the risk of infection. Certain resources will say that fresh fruits and vegetables are not permitted in a patient who's immunocompromised, that those things would need to be cooked. But this textbook says that they would just need to be washed, and then they would be able to eat the fresh fruit and vegetables as long as they were washed. For diarrhea, managing diarrhea, we'd get an antidiarrheal on board. And again, as with any patient with sort of persistent diarrhea, we would worry about skin integrity. So making sure the patient's clean and dry and using barrier cream if necessary. With diarrhea, again, we're watching for fluid and electrolyte imbalances. For preserving skin integrity, the big concern there is that Kaposi sarcoma that causes the low-grade vascular tumors. They are large lesions. They can cause pain, restrict movement, and impede circulation. Correction, they're not all large lesions. So smaller lesions can be painless, but if they are large, they can cause some problems for the patient. Usually, Kaposi sarcoma responds well to the antiretroviral or anti-HIV medications. Patient might also use chemo or radiation. Management of painful lesions includes analgesics or comfort measures. If the lesion is weeping, you want to keep it clean and make sure you have a dressing over it to prevent infection. And most patients are concerned about appearance, so they can wear long sleeve t-shirts or use makeup on closed lesions to cover up those Kaposi's sarcoma lesions. And again, they're sort of purpley brown papular lesions that appear on the patient's skin. All right, the last box within your textbook that I want you to look at on your own, there's a box titled Infection Control for Home Care of the Patient in Stage 3 HIV, which again is full-blown AIDS. So I'm living with a family member who has AIDS. What do we need to do to keep our living conditions safe and decrease the odds of transmission of HIV among family members? So I want you to read over that on your own. Make some flashcards if you need to, and just try to get comfortable with that information.